Hi, I'm Dr. Rich Sherman, and I'm hoping to give some ideas to clinicians, coaches, and educators about why you should consider adding biofeedback to your practice. Biofeedback is a learning process in which patients are shown real-time recordings of physiological systems such as muscle tension and are taught to recognize incorrect levels and patterns of tension proven to cause the problem being treated or worked with. This child has an electronic thermometer taped to her finger. She's being coached to raise low fingertip temperatures associated with onset of migraine headaches. Biofeedback is not magic. Rather, it's training. Well-known physiological signals are recorded using standard physiological monitoring devices. The output from these devices is sent to a computer monitor for viewing in real time by the client and any coach that might be present. For example, muscle tension biofeedback helps people learn to recognize incorrect patterns of muscle tension proven to cause tension headaches, and to correct those patterns. No signals go from the biofeedback device back to the patient to change the patient's physiology. Many biofeedback-based applications are not experimental. Biofeedback is not new, and for many applications, specific types of biofeedback for specific problems is not experimental. For example, muscle tension and temperature biofeedback to prevent tension and migraine headaches are accepted by many medical groups as being safe and effective. Numerous high-quality studies have shown them to be at least as effective as medications. Several medical groups recommend biofeedback to be the first treatment for these headaches. Biofeedback is widely used in educational, sports, and business settings. Coaches and educators use biofeedback for such problems as optimal functioning, attention problems, and anxiety control. Many Olympic and national level sports teams use biofeedback. Biofeedback is frequently used to help people perform better doing a variety of different types of exercises. This soldier's abdominal and chest respiration patterns are being recorded using belts which expand and contract as she breathes in and out. She's watching the patterns on a computer monitor. She's being taught to recognize how she breathes while doing sit-ups and push-ups so she can perform the exercises more effectively. Biofeedback is also widely used in the clinical environment. The following are disorders for which there is significant evidence that biofeedback-augmented interventions are likely to work as well or better than medications and other types of interventions for properly selected patients. First is migraine headaches. This is the one that's got the best research supporting it. It works best for migraine headaches of non-traumatic origins. Numerous meta-analyses of large random controlled studies show effect sizes from muscle tension and temperature biofeedback equal or greater than those for preventive medications and any other treatment. Second is tension headaches, including muscle-based jaw area pain. Once again, the effect sizes are equal or greater than those for other techniques. Third, ADHD. There's solid evidence from large studies that feedback of specific patterns of brain waves is very effective. This is called EEG biofeedback or neurofeedback. Overall, you can expect about 80% of your patients to eliminate between 80 and 100% of their symptoms. Details of the studies are available at biofeedback.org. Other disorders having significant research support for treatment with biofeedback include jaw pain related to muscle tension. This would be TMD, but not TMJ, the joint problem. Anxiety, Raynaud's syndrome, urinary incontinence among adult females related to muscle tension, epilepsy, constipation related to muscle tension among adults. Biofeedback recordings provide objective evidence of your client's reactions to stress and etc. for educational, sports, and clinical training. You can get an idea of when your clients have stress responses to particular topics, even when they're not aware that the topic is stressful to them. You can use the recordings to track changes in your client's conditions over time as therapy or training progress. For example, biofeedback is used during progressive desensitization to objectively track stress responses. This lets you know when it's time to proceed to the next step. Availability of this information speeds the process considerably. Of great importance, biofeedback is safe and has no significant side effects. Biofeedback is cost-effective in the long run. You don't need to treat side effects, have patients wind up in the hospital, etc. Biofeedback's a great way to expand your practice. When you add biofeedback to your practice, you can see clients with conditions you don't currently see. You can do better with many of the conditions you currently work with. Biofeedback is training, so you can do this without going beyond your scope of practice. Get more joy out of your practice. Biofeedback can be lots of fun for you and your clients. You get to work with really neat machines which provide lots of great information to you and your clients. Don't underestimate this aspect of adding biofeedback. It's just plain fun a lot of the time. Who can offer biofeedback-based services? For non-clinical uses, coaches and educators with proper training in biofeedback incorporate biofeedback-based techniques into their work with students, sports teams, businesses, and etc. They emphasize optimal functioning, concentration techniques, and etc. As I mentioned, many Olympic and national level teams use biofeedback. This is absolutely ethical, not to mention quite effective, as long as they don't attempt to treat clinical problems. These professionals train, not treat. For clinical uses, clinical professionals with state licenses working within their scopes of practice using biofeedback to treat conditions they're trained to treat. They should have extensive training and certification in biofeedback. These professionals treat through training. Both groups use technicians. These are people who have formal training in biofeedback but don't have professional credentials. They can work under the direct supervision of appropriately trained and licensed clinicians, coaches, and teachers. Here's what you need to learn and do to provide biofeedback-based interventions. First, take a course in general biofeedback, neurofeedback, that's EEG biofeedback, pelvic floor biofeedback, or several depending on what you want to do. These are 36 to 50 CE courses which teach you about different aspects of biofeedback, and especially how to integrate biofeedback into your practice. You can take in-person week-long courses or distance-based courses from your home. If you haven't taken a college-level course in anatomy and physiology, you need to take one. You can take one via distance education designed for people who will do biofeedback, or you can take one at a local college. You need both hands-on training in using biofeedback equipment and mentoring through your first few clients. You can work with a mentor in your area or via the web. Insurance covers some biofeedback-based interventions. Many patients are willing to pay for others. Want to know more about biofeedback and integrating it into your practice? Go to biofeedback.org for lots more detailed videos on biofeedback, for lots of details on efficacy and research, to find out about many more disorders biofeedback works for lots of information about training, and even to find out what AAPB can do for you. Thank you for listening. Remember, if you want further information, please go to biofeedback.org. Goodbye for now.